Hello, public health students. I've still been asked a lot of COVID questions, even though the pandemic continues to shift. And I don't have you all in class anymore, whether you've gone on to graduate or I just don't have you this semester. So I thought this was a good avenue to connect with you about some of your public health questions. I've had some questions come in around how do we interpret current COVID data? What does it mean? And now that the pandemic has really shifted, how do we interpret that? And this is important to understand that we live in this gray, right? I say that all the time in class. We live in the gray. It's not black and white. We don't have perfect vaccines. We don't have perfect answers. We don't have perfect data, but we do have some data. And our goal is to always think about others and protect them the best that we can. So with that in mind, what most counties are collecting for data is positivity rate, usually ICU rate. And so as we see these very few metrics, we first of all remember we need a lot of data to understand a disease. And so we know that in our field, we have been cut with resources. About 95% of our healthcare dollars in the US go to treatment and go to sick care instead of prevention. And in public health, we focus on prevention, but yet we get such a small amount of that funding. And so we really have a sick care system in the US, not a healthcare system. And so with that in mind, knowing that our healthcare systems are not set up to collect data, they're not set up to analyze disease, especially as it's changing and shifting over time. And so with those few rates that we are collecting, they're not giving us a great picture of COVID right now, because we know that the majority of the population, at least in the US, has either been vaccinated or had the disease. And so there's some level of protection that we have within our communities, within the places that we live. That being said, we also know that there are still very vulnerable populations. There are people who have comorbidities like diabetes or heart disease or cancer, and maybe the vaccine is not as effective for them. Or maybe somebody can't get the vaccine for some reason, or it just doesn't work as well as it could. And so because of those reasons, there are some people who are still at risk for severe disease. And that is our number one priority. How do we protect those people who can't do anything else to protect themselves, but we can protect them as a community? And so when we're looking at COVID data and positivity rates, that doesn't really tell us much right now. It tells us how much disease is in the population of those being tested, but we're not testing everybody, right? Or they're not always reported. So that could be an underestimate. But with that, we're not looking at data and we're not stratifying by disease severity. And I feel like that's one of the most important metrics that we're missing right now, where we need to see not just a positivity rate, but of those cases, what do they look like by gender, by age, by race, and severity level? That is probably the most important, because say you have a 15% positivity rate and they're all severe disease, that is a red flag. That would be, stop, let's pause our community and see what we need to do. But if you have a 15% positivity rate and they're all mild disease, then that's not as huge of a concern, because you know that those people aren't having severe disease, so they're not at risk for death, right? But we do know that there is more disease in the community, so we still have to protect those who are vulnerable. But do you see how you look at them differently based on severity? And so right now we're just not seeing that collected. So if you work in a health department, if you're graduated, you should start bringing up these conversations around how do we collect data in a way that really shows the picture of disease right now, and not just a simple positivity rate or ICU rate or hospital rate, just so that we can get a better picture as a whole, so that we can do what we can to protect those who are most vulnerable.